Welcome back to the SOS playlist for seniors. Today, I will be addressing how pain goes undetected or underrated in seniors and how this causes the pain disability spiral downward movement that causes loss of independence in seniors and could rob them of their quality of life. However, this ought not to be so if pain is identified early and addressed. Indeed, seniors can preserve their independence and continue to enjoy different activities. So let's get started and attempt to describe pain. The National Institute of Neurological Disorders describes pain as an unpleasant sensory and emotional experience. No two people feel pain the same way, even if the reasons for their pain are alike. Pain is a highly personal experience, and a person's report of their own pain is the best measure and the most accurate description. Pain can feel mild or it could be severe. It could also be acute or chronic. An acute pain many times is one that is recent and has not lasted more than 3 months. A chronic pain could be described as severe and one that is recurrent and has not responded well to any kind of intervention. Pain can also be described differently. It could be a prickling pain, it could be tingling sensation, it could be also stinging or burning, it could be a shooting pain, aching, or electrical sensation. However, pain is among the most important signals our body gives to help us to survive, and pain can alert us to harmful changes in the body. Whenever pain is experienced, and it is usually a signal of underlying issues, typically caused by an injury, a disease, or inflammation. Common causes may include acute injuries, chronic conditions, nerve damages, and metabolic issues, to mention a few. I will discuss examples of these common causes briefly, but first, let's differentiate between pain that is concerning and one that is non-concerning, a concerning and an unconcerning pain. Non-concerning pain has some discomfort that can happen after activity, like gentle soreness or stiffness that improve with rest, typically after prolonged activity, after some sedentary lifestyle, picking up a new hobby, standing for extra period of time during an outing, pulling a muscle during an overreach at home. Those are unconcerning pain, but concerning pain is different. This type of pain does not improve, and it's not usually linked to an increased activity, but it is usually sudden. It could be sharp. It is new sometimes, and it is usually worsening. It might begin to interrupt your sleep. It can also come with some swelling, some redness, some increased warmth, some drainage, or a general feeling of unwell. The focus of this video is pain that changes walking, sleeping, or breathing. And these are concerning pain because these changes are important as they cause a very spiral downward shift in seniors' independence and in their quality of life. Now we're going to talk briefly about the common causes of concerning pain. The first one I'd like to address is actually the most common one, apart from inflammation in seniors. It's one of injury or trauma, which is typically a fracture or a sprain after a fall. So this is really worthy to note that after a fall, it is important to have your physician actually check through an x-ray or any other suggested diagnostic test to make sure that there was not a break in your bone, just to prevent other complications like non-healing after a break, and if that was missed. The second one worthy to of mention is inflammation, and this is also very common, like arthritis, tendinitis, bursitis, and there are varieties of all these different kind of inflammation that actually are concerning pain that should be addressed. There is the cause of a nerve damage, compression, as we have in sciatica, in herniated disc, or even probably sometimes in carpal tunnel. Muscle strain is another one, causing back or shoulder pain during an overactivity, overreach, continued overactivity that is not sustainable by the state of the muscle. Current muscle in seniors will cause continued muscle strain that is not resolved. Infection is also a significant cause of concerning pain. Like when you have the appendicitis, that is a precise pain that needs to be, that should be addressed immediately. Or in the case of a kidney stone, we want to make sure that we actually, that is in concerning pain. And also in the case of a UTI, that is a bladder infection, you also have pain with urination. That is also a concerning pain, and that should be addressed immediately. There are also some chronic diseases, with the autoimmune disorders. You have the fibromyalgia, you have situations like cancer pain. These are all concerning pain and should be addressed by your medical physician immediately. Now, let's talk about what is next. If you have identified your pain, what is next? The next step is to report your pain to a medical professional, your physician, your nurse practitioners, or if you have a caregiver that is taking care of your medical needs and scheduling an appointment for you, please make sure you discuss that immediately with your caregiver. You want to also make a note of these few suggestions. You want to be able to identify or describe where it hurts, what part of the body hurts, when about an approximate time as the pain started, and what does it change? Is the pain changing your walking? Is it your breathing? Is it your emotional health, your ability to sleep, your appetite, or your energy? Those are points that are worth identifying before you schedule an appointment. You want to pay attention specifically to sudden severe pain that feels new or unusual, pain with fever, chills, or feeling sick, pain with any swelling, any redness or warmth or drainage are important to be reported. Any chest pressure, severe shortness of breath, or pain in the chest or feeling of fainting, that is a 911 emergency. Seek emergency help immediately. A new severe headache, confusion, or sudden weakness also requires immediate professional help. Any new pain that makes you unable to stand, walk, or use an arm or leg normally, especially after a fall or especially after a fall or after an overexerted activity, should also be reported. Remember, it is your responsibility to report your pain and schedule an appointment with your physician. According to the National Institute of Health, seniors experiencing pain should adopt a multidisciplinary approach to manage symptoms and maintain their quality of life and independence. Seniors must actively manage pain rather than dismissing it as a normal part of aging. Effective strategies for managing pain should include consulting doctors for personalized multimodal treatment plans, including pain medication, physical therapy, acupuncture, staying active with tailored exercises specific for the needs of the senior, utilizing hot cold therapies, maintaining a healthy diet, and addressing your mental health. These are all different multi approach to management of pain that have been found very effective according to the National Institute of Health. In conclusion, pain awareness is not about fear. Rather, it is about listening to the body and responding early. Speaking up counts because it will help your caregiver, and medical professional to address the situation in time. Please remember that although pain is common in older adults, it is not a normal part of aging that must be accepted. Instead, it must be addressed and treated. Early communication will prevent complications and reduce hospital stays. In conclusion, pain awareness is not about fear. Rather, it is about listening to the body and responding early. Speaking up counts because it will help your caregiver, and medical professional to address the situation in time. Please remember that although pain is common in older adults, it is not a normal part of aging that must be accepted. Instead, it must be addressed and treated. Early communication will prevent complications and reduce hospital stays. Thank you for watching this video. Please like, comment, and subscribe. This is Elizabeth Soares, physical therapist with the Seniors Aging Well Circle. Also, please find a free link to pain awareness checklist that can be used to track pain in the description of this video. In the next SOS video, I will address mobility changes and fall risk, and how small changes can signal bigger concerns. Thank you for being here, and remember that awareness today will continue to support your independence tomorrow.